while only 19% of African Americans in the state and 12% of Hispanics did. There's also a 36% gap in the high school graduation rates between black and white males in Illinois. In Chicago public schools, for example, the black male high school graduation rate is only 44%. And high school dropouts become incarcerated, attorney, at a shocking rate, with the young black men being disproportionately affected. 23 out of every 100 young black male dropouts were in jail, prison, or juvenile justice institution on any given day in 2006-2007, compared to only 6 out of 7 of every 100 Asian, Hispanic, or white dropouts. The devastating result of high school dropouts is painfully clear. Male dropouts of all races are 47 more times likely to be incarcerated than their peers of a similar age who graduated from a 4-year college or university. Not only are our youth choosing not to go to school, the reality is that even those who want to go are too scared to enter the building. Youth violence has escalated at an alarming rate. And Chicago public schools, where I'm from, and I'm a Chicago public school student, have experienced the effects of this violence firsthand. You all know this. Just a year ago, a cell phone video camera captured the beating and the killing of 16-year-old Darian Albert when he crossed paths with rival gangs on his way home from his Chicago high school. Although Albert's killing gained national attention after the video went viral all over the internet, he was one of more than 65 youth to die violently in Chicago during the 2009 school year. Albert's death triggered a renewed effort to decrease youth violence, but the issue remains unsolved for the third largest school district and school system in this nation. The students who attend Chicago schools can't hope or wish or dream that they'll be safe when they go to school each day. They rely on the officers who now patrol the grounds during the school day and the metal detectors that they walk through every morning. And even with these precautions, attorney, since Albert's death, 78 more youth under the age of 19 have been killed in Chicago. Overwhelmingly black on black shootings, Judge. Inequalities among the races transcend employment, education, wealth, and into healthcare as well. The United States spends an estimated $2 trillion annually on healthcare. Despite consistent increases in spending, disparities among demographic groups persist. Nearly 20% of African Americans are uninsured. In comparison, only about 1 in 8 whites lacks health insurance. Plus, low-income Americans and racial and ethnic minorities experience disproportionately higher rates, men, of disease, fewer treatment options, and reduced access to care. African Americans continue to have the highest rates post this dinner we just enjoyed, of diabetes, cardiovascular heart disease, hypertension, and stroke, as compared to all other racial or ethnic groups in the United States. In fact, 48% of African American adults suffer from a chronic disease compared to 39% of the general population. Black Americans experience new HIV infections at 7 times the rates of whites. And Hispanics experience new HIV infections at 2.5 times the rate of whites. These are just a few of the many harsh realities that we currently face as a nation. Unfortunately, they're not fantasies or nightmares we can wake up from. They affect each and every one of us, regardless of race, age, income, or political values, because they're part of the human condition. But they can be changed if we work together. Amen. Throughout its history, the NAACP has led our nation in moving forward. Now, I call upon our leadership again. I admit many of the challenges we face as a community cannot be surmounted overnight, but there are steps that we can all take to get a little closer to overcoming them. Our strength as a community begins with the success of our children, and their success begins with education. Generally, when poor black youth find themselves making the decision to reject formal education and engage in violence, it is because they lack educated, responsible, or willing parents. If children have never seen right, how can they do right? All too often, legitimate and mainstream success is dismissed as being limited to the white world. A successful black man or woman can help to remove this as a barrier to progress, and a devoted role model can show to those kids why an education is so important. And so, I didn't want to come this evening and just talk about the problems. I wanted to talk about solutions. And so I ask everyone in this room to become mentors and support mentorship organizations in your communities. Many youth are without adult support at precisely the juncture in their lives when they need it the most. And mentors can serve as role models, advocates, friends, and advisors. Through our guidance and support, we can show these young people that success is not just a dream, that the young black high school student can go to college and become a doctor, just like his white peers, because success is within reach. An educated population of young people directly translates into a more qualified African American workforce. I said it earlier, but it's worth repeating. African Americans face an unemployment rate in Illinois that is double that of whites, and that is nearly 10% higher than the U.S. average. These are very tough times for the American economy in general and the American middle class as a whole. They are especially, Brother Jackson, catastrophic for black Americans. Such a high rate of unemployment could further fuel the dynamic of downward mobility that is now pushing up the rate of poverty among blacks. One of the most effective ways to transform that prognosis is through the political process.
All right.
And that begins anew with voting this November. 2 years ago, the black vote helped change the culture of American politics forever when we elected our first black president into office. This culture requires our continued involvement, and that always starts with being a voice in the political process, Judge. Dr. King once said that our lives begin to end the day we become silent about things that matter. African Americans have the power to determine the winner and the loser in many state elections, local and national. And I charge you to organize our communities and ensure that we are not silent, that our voices do matter. This also means that we work with the NAACP to make elected leaders like the judge not only aware of the issues that concern black communities, but challenge them to make decisions on their behalf. The NAACP has always been at the forefront of change, and I urge us to continue to do it over and over and over and over again. The NAACP has taken strides to make health care for African American and minorities and changes. In the last year, the organization has shined a spotlight on the health and healthcare disparities, namely through its 880 campaign for real healthcare reform, as well as a symposium that recently took place at our convention this past July. The organization has initiated a campaign on HIV/AIDS that will focus on African American men in the faith community. Health workshops will provide an open forum to facilitate candid conversations about HIV prevention, offer screenings, establish training areas for education, and develop strategies for promoting awareness. While the NAACP has taken important steps in improving health care for all African Americans, I again urge us to do more. One way to address disparities in the quality of care is to support research that involves partnerships between academic researchers and healthcare providers who serve predominantly minority communities. With better access, Reverend, to information about diagnosis and treatment, attorney, clinicians and health decision makers will improve their ability to apply the results of research to minority patients. African Americans and other minorities must receive, Judge, tailored, individualized treatment in order to reduce and eventually eliminate the health care gap that currently exists. Demanding that healthcare professionals apply race-specific research when treating minorities are just one way. That's just one way of saying that we will no longer tolerate inferior medical care. Finally, I'm almost done. By taking steps like supporting mentorship programs, encouraging research in the medical treatment of minority patients, and challenging our communities to vote, we can all make equality and racial justice a reality for our communities.